I'm going to go over the exposure and injury response protocol. And this protocol is really important for those who may be injured at the job site or have an exposure incident from potentially a needle stick injury or getting cut by any instrument that is used in patient care and that has essentially biological material from another human being. One of the big things to understand is that exposure incidents happen. They most frequently happen with the newer assistants, where you are really not being as careful as you should be with handling of instruments. And it's really important to follow your trainers and understand that it can be just a second of something that you kind of take your eye off of and you can have an exposure incident. You do need to take comfort that there have been no cases of transmission of HIV from a patient to an employee in the history of dentistry. That does not really diminish your need to be super cognizant of sharp objects and especially objects that have been in or around the patient. The most concerning transmissible disease is hepatitis. So, upon employment, usually you're going to either make sure that you've had hepatitis immunization in the past, and then really what's important is not only getting your hepatitis shots, but testing them or testing your own immunity through a titer. So a titer basically just is a test to make sure that you have immunity from the hepatitis if you were exposed. So obviously very, very important to be careful around needles and especially surgical blades. The entire office, every time, if there is an exposure incident, what I try to do with my office is get everyone together and make everyone understand exactly what happened and if there was a lack of someone following protocols or if we could actually do something to reduce those exposures in the future. And so every time that someone is exposed, I take that as a learning experience. So we have had patients and staff that have been exposed, and it's one of those things where it's a time of like really high stress for the assistants. And the best thing to understand is just be calm. It happens throughout all of the medical community, and there are protocols that we all follow to minimize, if not eliminate, any risk of future issues. So you do have the decline, you do have the right to decline to be seen at an urgent care, although I would highly suggest that you take that very seriously. Now, why would you might decline to be seen at an urgent care? If you assess or you and the attending doctor assess that maybe the risk is null to, very, very low, that might be appropriate. For example, if you scratched yourself with an object that was a little bit blunt and the source patient was a young child that probably has never been exposed to any communicable diseases, then it might be appropriate to say, hey, I don't think that this warrants me going to urgent care. But if there's any question, just understand that we actually encourage you to be safe than sorry. So we have workers' compensation insurance that would cover your visit to urgent care. You do not have to clock out while you're going to urgent care. And so it's just one of those things where it's mostly better to be safe than sorry. So after you've identified the source patient, it would be good if you could identify it quickly enough if the source patient is still in the office. You or the attending doctor could explain what happened and then request them to go to urgent care with you so that they could also be tested for potential communicable diseases such as hepatitis or HIV to make sure that you are given the right medicine to make sure that you don't, you have a less chance of contracting it. So the things that you're mostly going to take to the urgent care would be the source patient's medical history, hopefully the source patient. And although it is not absolutely required, if the source patient refuses to go to the urgent care, we cannot obligate them to go to the urgent care. And then the final will be an OSHA Form 301. And this OSHA Form 301, we'll see that in just a second, contains all of the information that you will need to create the claim with the workers' comp insurance and to also log it for OSHA requirements. So, and all of the urgent cares that we have selected have to have what's called rapid AIDS testing, which is they can test within 24 hours if you have been exposed to an HIV patient. So it's super important for that because then the regimens can be dialed in and you have a less chance of contracting it. Obviously, I just said you will stay clocked in while going to urgent care. And so first thing that you're going to do to access some of these documents is you will go into the Open and Affordable and Dental Braces website. And then if you scroll down to the very bottom, you're going to see this login button. So I'll just show you here briefly. If we go all the way down here, you're going to see this login button. Okay. When you're logged in, it will have your icon there or your office's icon. When you're not logged in, it will simply look like this, meaning you're still needing to log in. Okay. You will sign in using Google and use your office email. And then it'll essentially, the website is now logged in. So now you will go to About Us and go to the Team Access portion of the website. If you get this timeout error, that means that you did not properly log into the website, okay? And it would be good, most likely you're listening to this as a new employee, it would be good for your attending doctor to show you how to log into the site or see if on the computer that you're watching this on, if you can log into the site, especially if you're in the office, because then it'll allow you to have gone there once. And when you do need to access it or your attending doctor needs to access it, if you do have an injury or exposure, you'll have already gone through it. So once you're logged in, you're going to select the office, and then you are going to go down to the documents, and you're going to be able to access both this video and the forms that you're going to need to fill out. Okay. So once you access the forms, you are going to essentially, here's the Bennett version, you're going to have access to this OSHA Form 301, which is the main form that you're going to need to take to urgent care. And then this Form 300 and 300A are for the attending doctor to log the information on what actually has happened. So what you want to do here is you're going to kind of identify the information that you would need to fill out here, which is essentially going to be your name, information about when the accident happened or the exposure happened or the injury happened. And then you are going to, it's going to also have very important information down here on the bottom right. So on the bottom right, it has all of the urgent care information that you need, okay, with the address. And this urgent care has been selected as the closest one to your office and the one that has the 24-hour HIV exposure rapid test. And it also has their phone number. So you're going to direct yourself to that office and it will have those hours, okay? So if there is a case where on a Saturday, in this particular instance, that you were exposed after 4 p.m. and you want to be seen at the urgent care, but they are closed, there is an alternate version with 24/7 ability to take you in, and it has their address and phone number. So important to look at your urgent care location, which is obviously office specific. Okay. Now, when you get to urgent care, they are going to see you without any payment. But what they are going to expect is that you will call them back with a case number. If you do not give them a case number from the workers' comp insurance, what's going to happen is they're going to bill your office directly versus billing the workers' comp insurance. So it's important to look at this workers' comp insurance information so that you can create that case number. Some of the workers' comp insurances allow you to create the claim online. Others you have to call in and talk about the case with a case manager, and they'll go ahead and create a case number for you. Okay. So a lot of times what you're going to do is if you have time at the urgent care waiting room, you're going to go ahead and fill in that information onto that printed OSHA form 301. Okay. And the way that you're going to do that obviously is you're just going to go file, print. Okay. And then you're going to see this form 301 is ready to be printed. Your office might have a couple of these hard copies available. Sometimes if they don't, you can just print them off directly from the website, okay? So at the urgent care waiting room, while all of the details of the injury or exposure incident are fresh in your mind, you are going to fill out all of the information. And then what you are going to do is you'll be seen at urgent care. Once you're done with urgent care, you'll usually make your way back to the office if it's early enough in the day, and you will call your workers' comp insurance and get the claim number. And you will write that right on that OSHA form 300. Okay. Or excuse me, on the form 301. Okay. Then you will call the urgent care back and provide them the claim number. Okay. So the claim number goes both onto the OSHA form and also back to urgent care. Once that is done, you will go ahead and once the entire document is filled out, you will present it to the attending doctor. Okay. And you will make sure that you have filled it all out and you've included the claim number. And then you will check that, yes, I did call. And then you will scan that into your employee SmartDoc. So under Eaglesoft Patient Management List, providers, select provider, you'll go to the attending provider will go to your SmartDoc and then scan all of this information in, and then it is part of your employee record. Okay. The attending doctor will then fill out the OSHA form 300, which is basically just a one line item information that basically says how many exposure incidents they've had during that year and what exactly was the injury. That form 300 will then automatically fill in this OSHA form 300A. Okay. The attending doctors or the owner doctors usually will create a new copy of this every year so we can log it by year. So just a quick review. If you do have an exposure incident, understand that it does happen. It's important to try to be as safe as possible. If you do have an exposure incident or an injury, it does happen. And it's best to just kind of stay calm and go through all of these protocols to make sure that you are as protected and as safe as possible. You will try to take the source patient to the urgent care or have them report to the urgent care. You will take the patient's medical history, which will be found in their Eaglesoft SmartDoc, and you will take the OSHA form 301 with you. Okay. Then the way to print up that form is through the website login. You'll go to the team access. You will then go to your office, go down to the OSHA compliance documents, and you will then have access to this document. It's specific to your office. You will print one out. It will have all of your workers' comp insurance information there to create the claim number. You'll also have the urgent care where you're going to. You will go to the urgent care. You will be seen there, hopefully together with the patient. You will follow the protocols that they suggest. You will then call workers' comp, get their claim number, and then call back the urgent care and provide them the workers' comp claim number. You will then make sure that the document is completely filled out and signed, and then you will present it to the intending doctor. That doctor will scan that information into the employee smart doc and then fill in the other form, which will be this OSHA form 300 that just logs all of the exposure incidents. And that would complete the entire exposure and injury response protocol.